Welcome back to McMaster's Demystifying Medicine. Today's episode is going to cover biodegradable polymer drug-eluting stents. Did you know that your heart beats approximately 100,000 times per day, pumping about 5 to 6 quarts of blood each minute and about 2,000 gallons per day? Our blood passes through a complex network of blood vessels known as arteries that spread across our entire body, ensuring that we get the necessary blood supply required to stay alive. You can think of these arteries as a highway, carrying large amounts of cars at high speeds in order to move from one place to another. Similarly, our arteries can carry out large amounts of blood at high speeds to reach far destinations in our body. However, similar to a traffic jam, sometimes these arteries can become blocked. This prevents the flow of blood from reaching its target destination, and while a traffic jam can clear itself up, blocked arteries cannot do the same. So what do we do in these situations when blood is not able to reach its target destination, especially since these blockages can become life-threatening? Well, this is where stents come in. In this video, we will be exploring current and novel stent technologies. We will introduce biodegradable polymer drug-eluting stents and their mechanisms. We will compare them to previous stents, and we will look into the risks associated with the biodegradable stents and the further research that is required. So you might be wondering, what are stents anyways? Stents are basically small mesh tubes often made of metal or plastic. These are inserted into our arteries if there has been a buildup of plaque creating a blockage in that artery. The stent's job is to hold that artery open so that blood can flow through the artery and it can retain its function. When placing a stent in an artery, the doctor will often make a small incision in the artery of either the neck, the arm, or the groin. From there, a catheter will be used to feed the stent into position. A catheter is a thin flexible tube with a deflated balloon at one end. When the catheter is inserted at the appropriate position, the balloon is inflated to open the artery at the site of the blockage, and the stent is inserted in its place to keep the artery open after the procedure is done. Up until recently, there have been two main types of stents that have been used in medical procedures. The first are the classic uncoated metal stents that we had just described. They are inserted to keep the artery open at the site of the blockage. The second are drug-eluting stents. These stents work similarly to the ones we've described before, except that they have the ability to release a drug into the body that will work to prevent further blockages from occurring.
While current available forms of stents have been effective to some extent, they have also shown to have a few deficiencies. Restenosis has been a common issue that arises with the use of metallic stents, that is, the re-narrowing of the arteries. Other possible issues include the inflammation at the insertion site and heavy bleeding as a result of infection that could further lead to the malfunctioning of these stents and consequently the re-narrowing of the vessels once again. Although drug-eluting stents compensate for some of these issues, the main obstacle lies in the risk associated with the management of the stent after it is no longer needed. Stents are designed to be permanent fixtures in the body at the site of the blockage. However, this can become problematic as its prolonged presence in the body can lead to a plethora of further complications. Such side effects include trouble breathing, blockage in the stented artery, blood clots, and in some severe cases, heart attack and stroke. To explore this further, we can see in this example, there is a normal stented artery compared to an in-stent restenosis. When observing the two, we can see that there is significantly more inflammation and narrowing of the artery with the in-stent restenosis. Additionally, previous stents inserted in patients have either been regular metallic or drug-eluting ones. However, the materials used in these stents were not biodegradable and contained stainless steel components, both of which can be linked to increased risk of complications. To address these deficiencies, researchers have developed a new and more advanced version of stents known as biodegradable polymer drug-eluting stents. The short form of this is BPDES and will be used in this video to refer to these kinds of stents. BPDES are specialized by their ability to deliver drugs to narrowed and blocked arteries. The term polymer in its name refers to the materials whose chemical and physical characteristics undergo deterioration and completely degrade when exposed to microorganisms. Now that we've explored current stents as well as what BPDES stands for, we can now go over the mechanism that BPDES uses.
Biodegradable stents have the potential to completely degrade or break down the polymer simultaneously or immediately after the release of the drug. Fully expandable biodegradable polymeric stents provide the mechanical support to the vessel wall combined with the appropriate radial strength, which is the amount of force needed to compress the stent. These two factors work together to prevent mechanical recoil after immediate implantation of the stent. When arterial remodeling achieves a relatively stable phase at 6 months, the mechanical support is no longer needed. As a result, after drug release, the biodegradable stents are designed to dissolve in the human body, leaving behind the intact vessel with no pro-inflammatory substances or obstacles. During this dissolving process, the stress placed on the artery from the placement of the stent is gradually removed as the biodegradable polymers soften. In addition to the polymer being biodegradable, one of the components used in BPDES is made of ultra-thin metal cobalt chromium rather than the thick stainless steel mostly used in common stents, thus making it the thinnest strut that is currently available.
When comparing biodegradable stents to the stents used in the past, many differences can be noted. For one, BPDES has shown to decrease the risk of late complications such as in a stent's restenosis. Again, restenosis is when section of a blocked artery that was originally opened up with stents becomes narrowed again. BPDES also has the potential to reduce the inflammatory response often observed in the previous stents and prevent metal interactions with the arteries, which reduces the stent's fragmentation. To add on, previous stents often require antiplatelet therapy post-stents implementation to help prevent blood cells called platelets from sticking together to form a clot, which would form due to prolonged presence of the stents in the body. With polymers dissolving in BPDES, long-term antiplatelet therapy would not be required. Up until now, we have focused on all the way BPDES has improved stent technology, but we have to remember that this technology is still fairly new, and so there are still a few risks associated with its use that researchers are looking into overcoming. First, one problem with BPDES is that they are weaker in comparison to previous stents, which could contribute to the higher probability of the artery collapsing, meaning the stents must be replaced. Also, the anti-inflammatory drug can increase the risk of cell damage, which could lead to a variety of side effects ranging from milder ones such as nausea or headache to severe side effects such as life-threatening allergic reaction. Lastly, the anti-inflammatory drug administered through BPDES to prevent the foreign body response can delay the healing of the lining of the blood vessels. But how do we address this potential risk of BPDES? Well, researchers are looking into increasing the strength of BPDES by using intermetallic compounds such as nickel titanium as a non-surface portion or bulk portion of the stent and polymers on the surface of the stents. To address risks associated with the anti-inflammatory drug, researchers have approved a variety of different drugs that can be used in its place and have recommended that patients be tested before insertion into the stent to decrease the risk of allergic reaction. In terms of improving the healing rate, further research is still required to gain a better understanding. Researchers are also looking into slowing down the rate of degradation to increase drug-eluting time and produce more effective stents. To review what was covered, we start by exploring what stents are and why they are used, as well as the different stents that have currently been used. We then introduced biodegradable polymer drug-eluting stents, explored how they work, and compared them to the previous stent technology. We acknowledged that the risks associated with BPDES and what researchers are currently doing to address them. To learn more about BPDES, you can visit the following resources.